Good morning, my name is Michael Page. I'm Workforce Development Manager for Ananda Aged Care, and this is just a brief video or webinar on the 2020 flu season and influenza vaccine advice for all staff at Ananda. So you'll be aware that we're at the moment in an unpredictable situation regarding COVID-19 or the coronavirus, which is currently a pandemic. We have cases in Australia and we've had deaths in Australia. What I will advise everyone to do is to try to ignore as much as possible the media speculation and social media in particular, scaremongering, which is really not helpful at this time, and try to focus on facts and the science that is involved. The Australian government, the South Australian Health Department, and Ananda will provide factual updates as soon as they're available, which are based on science, which are based on evidence, and which are not intended to hide any facts, but are intended to allow us to make sensible and reasonable decisions to protect not only residents, but our staff. So COVID-19 is obviously, uppermost in our thoughts, but the reality is, even if someone who has a healthy immune system contracts COVID-19, the chances of them dying is minimal. The chances of someone dying from influenza A or B is higher, and in any case, the most vulnerable people in our population are people who live in high density areas and people with compromised immune systems, which is older people and people in aged care in particular. Ananda Aged Care has to be extremely vigilant and do all that's reasonably practical to minimise the risk of any sort of infection or outbreak at either of our homes, whether that's COVID-19 or influenza A or B. The reality is we're about to enter a new influenza season or year, and over the last 3 years we've had some extremely bad flu seasons. In 2017 there was a very bad flu season in Australia, and last year was extremely bad as well, and unpredictable in the sense that normally the flu season in South Australia peaks around August, September, and last year we had cases in May, and indeed at our Findon home we had an outbreak where we had to essentially lock down the home for 8 days because we had 10 residents and 3 staff who had influenza A. So one of the reasons we are particularly vigilant this year is not just because of the COVID-19 pandemic, but the reality is that the 2 ways we can protect our residents against influenza and COVID is strict hand hygiene, and you all will be going through hygiene audits and training if you need training. To ensure that we are, as far as reasonably practical, keeping it's not a sterile environment, but a clean environment in our homes. Our kitchen staff are working very hard to ensure the safety of food coming from the kitchen and hygiene in that sense. All staff, whether they're carers, admin, maintenance or managing directors, it doesn't matter. Everyone needs to be extremely vigilant on hand hygiene and actually practice it on a day-to-day basis. And that includes being politely assertive with all visitors to our home that they do the same, including and especially doctors who are moving between residents at our home. Everyone needs to perform hand hygiene, and that includes washing your hands in warm soap and water, not just throughout the day using a hand sanitizer. So number 1 lesson today: always wash your hands when you come into the home, always wash your hands before you leave because you'll be taking bugs home with you. Always wash your hands before and after meal breaks, always wash your hands after going to the bathroom. Okay, so that's hand hygiene. I'm now going to go through a presentation on influenza with some information on what the advice from ATAGI, which is the Australian board which advises on vaccines in Australia, has told us we need to do this year.